The Oxford Medical course is unique in that we spend the first year focusing on the preclinical science, so covering things like anatomy, biochemistry, physiology, but right from the start we also have exposure to clinical practice. So you'll spend 1 day a week either with a GP or in hospital learning how to take a history from patients, learning how to examine people. So you're really set up then for the second, third and fourth years when you then focus on learning clinical skills.
What else is unique? Well, we have a sort of emphasis on the sort of academic research basis of medicine. So it's not just about learning facts. It's about understanding, what underpins those things that we know about the human body, what underpins those things we know about medicine, what treatments work, understanding where that research comes from, but also giving an opportunity to people to explore those things for themselves, to make connections. We're amazingly lucky to be in a world-class university.
There's a lot to be said for studying here if you want to develop an academic career and be research active as you progress through your training.
We also have lots of opportunities for students to find what interests them. So for example, we have an academic special interest project running in the first and second years where you can choose a topic of research that might interest you or find a clinical audit project that interests you and then pursue that.
It's a small group of people which is unique, I think. There are other graduate entry medicine programs in the UK, but some are much bigger than the course here. But that means that I and the other course directors really do get to know the students individually. It's a course where you have teaching both in the university, in the faculty and in the colleges. You'll probably have heard about other people talking about the college-based teaching. That really is a unique thing to this programme. The academic support that you get through colleges, the welfare support, the wellbeing support you get through colleges.
There are between 2 and 6 medical students at each of the grad entry medical colleges, and then in their colleges they have much more individualised small group teaching where they will go through each of the topics that they've covered in their lectures with a specialist tutor. When we interview applicants for the Oxford grad entry medical course, we're really looking for students who are obviously bright, but enthusiastic about the practice of medicine. We want students on this course who are going to go on and become good doctors, and that's the most important thing that we're looking for.
Someone who wants to be a clinician, probably a researcher too, who's interested in medicine, ideally in the NHS.
Has really done their homework, finding out what medicine is like, what the NHS is like, has really spent some time thinking about it.
Someone who's interested in the human condition, what it is to be a person, what it is to be a patient, what it is to be alive, what it is to be sick.
Perhaps look in from the outside and you think maybe Oxford's not the sort of place that I'll fit in. You maybe have some stereotypes about what Oxford medical students are like.
So we have some absolutely excellent students who are the first in their family to go to university, are not from a traditionally academic background.
We're not fussed about what kind of school you went to or where in the country you come from.
We have people who, for whatever reason, have left existing courses and then joined Oxford and done brilliantly.
So there's not one set Oxford medical student. There's nothing that you have to be like. There's nothing that you have to turn up thinking you've got to be like this stereotype.
Some people come straight out of an undergraduate degree. Other students have done a PhD and worked in research for several years before coming to the course. And this means that we actually have a really broad range of students coming onto the course, and I think that's one of our real strengths. We've got a real mix of people.
What do I really appreciate about the students? So I think commitment to the course, commitment to medicine, often to the NHS, commitment to each other.
I love the way our students in each year form such a great bond with each other. They really are a fantastic group. They make great friends on the course. They really support each other. They have each other's backs.
So there's a strong sense of altruism amongst many of the students. Been a tradition of the final year grad entry students giving clinical skills teaching to the first years as they prepare for their clinical exam at the end of the first year, just really for the joy of passing on knowledge.
I think I'm most proud of what our students go on to do. Yes, we're hopefully training people to be great doctors, but hopefully we're also helping people to, develop into very broadly great clinicians and really great people with great communication skills.
Some of them work in academia, so they go on to have clinical research careers. Some of them go on to become general practitioners. Some of them go on to be hospital specialists. Some of them get involved in teaching, and others get involved in other things like health policy or global health initiatives. I'm really proud of the way all our students manage to find their own path and go off and do some really exciting things.
When I look at those students who have graduated from the programme, and the great thing about my job is so many people keep in touch with me and tell me what they're doing years down the line, and I hear what students are doing, and I think it's probably one of the things that I'm proudest about.